I'm Dr. Tiffany Schatz. I'm a thoracic and general surgeon with Doctors Community Surgical Associates. The advantage of being able to provide minimally invasive staging and treatment of lung cancer here at Doctors means that we can provide all of the different aspects of cancer care here at Doctors. We are the only facility in the county who's able to do that, including the radiation, chemotherapy, and surgical treatment at state of the art. So your thoracic cavity is essentially your chest, between your breastbone and your backbone, enclosed by your ribs, which includes your lungs, heart, esophagus, which is the tube between your mouth and your stomach, and most of the biggest vessels in your body. Thoracic surgeon is a person who has subspecialty training in doing surgical procedures in the chest cavity, which is the thoracic cavity. And a thoracic surgeon has special skills to remove lung tissue, lung cancer, to deal with the diaphragm, which is the muscle between your chest and your abdomen. We are able to reconstruct the chest wall and take lymph nodes out of the middle of the chest. There are other tumors in the middle of the chest that can also be removed by a thoracic surgeon, including things like thymomas, esophageal cancer. Some of these are more rare, but a thoracic surgeon is trained to operate in this area. Types of thoracic surgeries include lung surgery for various lung conditions, including cancer and benign conditions, as well as chest wall surgeries with ribs and surgeries to remove or repair the esophagus. Thoracic surgeries include removing other organs that come into the chest, such as if you have a big thyroid mass that goes behind the breastbone, or you have a hernia in your diaphragm, or your abdominal organs are pushing into the chest. So repairing that and removing those things are part of thoracic surgeries. Lung cancer is an abnormal growth in the lung tissue itself. Cancer is tissue that is growing abnormally and has the potential to spread and continue growing into other surrounding tissues. And this is concerning because that can be life-threatening and has a high mortality. In fact, lung cancer has the highest cancer mortality in the country. So it is a major concern if someone has a lung cancer. It has the potential to spread to lymph nodes, which are the immune tissues in the chest, as well as to other organs like the liver or the brain. And that can be a major problem. There are several different types of lung cancer: small cell and non-small cell. Non-small cell is typically the kind of lung cancer that we operate on because we can catch it early enough that it hasn't spread outside the lung. Risk factors for lung cancer include smoking, family history, personal history of other cancers, and exposures to other toxins. Sometimes people who don't have these risk factors can still have lung cancer. So it's something that we still try and keep in mind if a patient comes up with a chronic cough or a lesion on the lung. We can still treat it the same way, regardless of whether the patient has had risk factors or not. But the most important risk factor is smoking. The most important thing to do to prevent lung cancer would be to stop smoking, not smoke, and to encourage your relatives and friends to stop smoking. Symptoms of lung cancer typically involve breathing because it's a part of the lung. So patients will often present with a cough that doesn't go away, Maybe they have a shortness of breath. A lot of times people will be treated for pneumonia and then those symptoms don't go away, and lo and behold, later we find there's a cancer underlying the infectious process. Other things people should be aware of for lung cancer are coughing up blood or having chest pain in an area that persists, and more general symptoms of lung cancer are similar to other kinds of cancers, like weight loss and fatigue, change of appetite. So if a person develops some of these symptoms, it is something to seek a primary care physician to find out what's going on, whether lung cancer or any other kind of problem. One less common finding that can be related to lung cancer is a change of voice because of the anatomy. Essentially, your nerves that come to your voice box come into your chest and around blood vessels. So if you have a lung cancer there and it starts invading into the nerve, you can actually develop hoarseness. And sometimes that's a symptom that patients present with. Lung cancer is diagnosed similarly to other cancers with a biopsy. So first we have to find out, is there something there? So for example, if a patient has a problem like one of these symptoms that we've discussed, they present to their primary care physician or pulmonologist or the emergency department, and there, after a physical exam and a history taken by the doctor, some imaging will be done, typically a chest X-ray or a CAT scan. And with that imaging, we're able to see something, an abnormal finding. It's usually a small nodule or lesion, or mass is what it's called. At that point, we typically do not call it lung cancer, we call it a mass. And then from there, we need to take a biopsy. There are several different ways that we can biopsy a mass of the lung to determine if it is lung cancer. One way is CT-guided biopsy, which means that you have a CT done and the interventional radiologist will put a needle through the chest wall to take a sample of the tissue. Another way is through a bronchoscopy, which is where we put a camera down your airway when you're put under anesthesia and take some biopsies of the airway from the inside. Sometimes we will take a biopsy of another site. For example, if we do some of these scans and we see that there's not only a mass in the lung, but there are nodules or bumps elsewhere, like lymph nodes. Sometimes we'll biopsy the lymph nodes and find out if it's lung cancer. Then we can see whether the lung cancer has spread to the lymph nodes and what exactly it is. So there's a few different ways, but the main thing is to have a biopsy where the pathologist, who's the doctor who looks under the microscope to determine what kind of tissue it is, will tell us this is lung cancer, as opposed to some other kind of growth. The question of whether lung cancer is preventable is a really good question because we all want to prevent cancer and illness in ourselves and our loved ones. And I would like to re-emphasize that we can reduce our risk of lung cancer by not smoking and stopping smoking. It has a significant impact on your risk of developing lung cancer. However, not every lung cancer can be completely preventable. One of the things that we do and we know is very effective to reduce the risk of dying of lung cancer is called lung cancer screening. This is a low-dose CT scan which shows nodules in the lung, and we can find out if somebody has nodules in the lung if they have the risk factor of smoking for a long period of time. This was found by a very large study to reduce the risk of dying of lung cancer by 20%, which is actually greater than reducing the risk of dying of colon cancer or cervical cancer or breast cancer from those screening initiatives like colonoscopy, mammogram, and pap smear. So lung cancer screening is a newer form of screening, but it is the best way that we know to prevent dying from lung cancer in patients who have high risk factors of smoking. The treatment options for lung cancer include surgery, chemotherapy, and radiation. The treatment depends on what type of cancer the patient has and the stage of cancer. The stage of cancer refers to how big it is and how far it's spread outside the original spot on the lung. So an early stage lung cancer that is contained within the lung itself is typically treated by surgery. Surgery has the highest chance of cure, so what we want to do is remove the cancer before it spreads to the lymph nodes or any other organs, and the patient has the highest chance of cure. If a patient is not a candidate for surgery with early stage lung cancer, they can have radiation therapy. Radiation is not as effective as surgery, but does give a reasonable chance for cure for a patient who cannot undergo surgery. When the lung cancer has spread outside the lung tissue itself to the lymph nodes in the middle of the chest, especially on the same side as the lung cancer, we can do chemotherapy and radiation and then do surgery with a good chance of treatment response or cure from surgery. If the tumor itself has spread to both sides of the chest of the lymph nodes, then we can do chemotherapy and radiation as the therapy for the lung cancer. This is not as effective as surgery, but it does have a chance of cure for lung cancer. When a lung cancer has spread outside the chest into other organs, this is called stage 4 lung cancer. And we can't treat that with surgery or radiation, but we do give chemotherapy to shrink the tumor down and prevent it from growing so that the patient can continue to have a good quality of life and more days ahead to spend with their family. Patients can request lung cancer screening, and it's important for you to know if you are a candidate. The insurance companies will pay for lung cancer screening, and so will Medicaid, Medicare. It's been proven to be effective. So the patients who qualify for lung cancer screening are patients over 55 who have had at least 30 pack years of smoking, which means 1 pack per day for 30 years, or 2 packs per day for 15 years, or 4 packs per day for 10 years. So essentially, if you've had that amount of smoking and you're over 55, your risk of developing lung cancer is high enough that it is reasonable to get lung cancer screening with a low-dose CT scan. Typically, the age to stop lung cancer screening is between 75 and 80. History of smoking typically is within the past 15 years. So if a patient has stopped smoking 30 years ago, typically they are not candidates for lung cancer screening. Robotic-assisted lung cancer surgery is performed using a minimally invasive camera, and we're able to look inside the chest and use small incisions with special technology to remove the lung cancer. This will include about 4 incisions on the chest wall between the ribs, and using the robotic arms, the surgeon, that's me, is able to control the movements of the hands of the instruments to carefully remove the lung tissue and the lymph nodes in the middle of the chest to cure the lung cancer. The benefits of robotic surgery are several. One is similar to minimally invasive surgery, typically less pain, less blood loss, less complications, fewer infections postoperatively. And all of this means that the patient will recover faster from surgery and be able to go home more quickly after their surgery. The other benefit to robotic surgery is that we're able to be more precise in removing the tissues, which means that I'm able to take more lymph nodes in the middle of the chest and get better results from the surgery. By removing more lymph nodes from the middle of the chest, we're able to reduce the risk of the cancer coming back and hopefully have a better cancer response and treatment. Preparing for lung cancer surgery is very important. It is high-risk surgery, and it involves some of your most important organs in the chest cavity, including your lungs and your heart. So it's very important to try and be active before your lung cancer surgery. And I recommend walking for at least 20 minutes a day, which can be put into two 10-minute episodes. But walking briskly and increasing your lung function and your heart function before lung cancer surgery will improve your outcomes afterwards. Another really important thing to keep in mind before lung cancer surgery is your nutrition. So maintaining a healthy diet and improving your protein intake is important to allowing your body to heal after surgery. So another really important factor is smoking. Smoking increases your risk of pneumonia after lung cancer surgery, heart attack, stroke. Essentially, it's very important to stop smoking regardless. Well, lung cancer surgery, like most major surgeries, you come into the hospital without eating or drinking in the last 8 hours. Waiting for your surgical team and the anesthesia team to interview you. A lot of times people find they're asked the same questions over and over. What surgery are you having done today? Who's your surgeon? What side of your chest is the surgery going to be done on? And we do ask that you be patient with these repetitive questions, but they're essentially for your safety, that we all are on the same page and that you know and we know that we're doing the right procedure. Your surgeon will mark the side of the procedure so that once you're asleep, we know and you know which side we're going to do the procedure on. Once you are ready to go back to the operating room, the anesthesiologist will give you medication that makes you forget what's happening. And oftentimes patients will say, I remember starting to wheel back to the operating room, but that's it, that's where it cuts off. And so essentially what will happen is you have a nice nap and you wake up in the post-op area recovering. Sometimes at that point you will have pain and sometimes you won't. But the nurses who are in the recovery area will help you and take care of you and make sure that you have what you need. If you have nausea or pain or trouble breathing, they will respond and make sure that you have the appropriate treatments. After lung cancer surgery, you will have a tube coming out of your chest, which is a drainage tube. This helps to drain the air and fluid that leaks from your lung. Just like any cut, it needs some time to recover. And because your lungs are involved in breathing, some air will escape from there. And we have the tube to help pull that out of the chest and allow it time to heal. Because of the cuts in your chest and the breathing that you do constantly, your incisions tend to be sore. And so we will give you pain medication and help you with managing that pain. After lung cancer surgery, it's very important to continue that deep breathing that will keep the lung open and prevent you from developing complications like pneumonia. So the pain management is especially important for lung cancer surgery. One thing that's important after surgery, and especially chest surgery, is moving around, because moving around helps you to keep the lungs open and breathing. And so even though you've had a major surgery and you have a tube coming out of your chest, we do very much encourage and need you to be walking around the hallways in the hospital and doing that deep breathing and eating what you can to help your body to normalize and heal from surgery. Recovery time from lung cancer surgery is dependent on the type of surgery that we do. If we do the minimally invasive surgery with the small incisions, typically you're in the hospital for somewhere between 2 and 5 days until that leaking from the lung stops and we're able to take the drainage tube out. After that, you go home for more recovery. And usually after a couple of weeks, you start feeling more yourself. Because it is big surgery, it's major surgery, a lot of patients will still have some discomfort that lasts up to a month and can experience other symptoms like fatigue or decreased appetite just because their body is working so hard to heal. And that's normal. Every once in a while we'll have a patient that says they feel a little bit sad, and that's also normal after surgery and a major surgery for cancer. One thing to expect and understand is that there are a lot of psychological aspects to having cancer and to having a major surgery. So giving yourself time to heal even after your physical body has healed is very important. And having family and friends around you to spend time with and talk to is also very important. Our multidisciplinary tumor board is a group of expert physicians who bring their expertise from different specialties, including radiation oncology, medical oncology, surgery, pathology, and radiology, to discuss patients who present with new cancers and new masses, that we can decide what's the best way to biopsy or what's the best approach to treatment. These are the people who comprise the treatment team for each and every patient. Especially if a patient needs multiple types of treatment, we coordinate and collaborate to make sure that the patient's care is seamless and they have the best outcome from their cancer treatment. I think people should come to Doctors Community Hospital for their lung surgery and their lung cancer treatment because we have all of the aspects of cancer treatment available here with, as I mentioned, medical oncology, radiation oncology, the minimally invasive surgery, which is not available at any other hospital in the county. In addition, patients who live in the community can have their treatments done here instead of having to travel into the city or to another county to have their treatments done. And this is helpful because it allows patients and their families to be together during these important times and have the support that they need instead of dealing with the traffic and the distance, which a lot of times keeps patients alone in the hospital when their families aren't able to come and be with them.